I am a neurologist. And if you're over 60, what I'm about to reveal could change your routine forever, or save you from a silent tragedy. Most elderly patients I see at the hospital never imagined they were just hours away from a stroke. They felt fine, had healthy habits, avoided fast food, walked every day, took care of their diet. But even so, they would wake up with slurred speech, unable to move one side of the body. Or worse, they wouldn't wake up at all. The culprit? Often, it was sitting right there in their kitchen fruit bowl. You've been told your whole life that fruit is healthy. And yes, it can be. But what almost no one tells you, and what most only find out too late, is that after 60, your body no longer reacts the same way. Your kidneys filter more slowly. Your liver doesn't metabolize medications as efficiently. Your blood vessels become more fragile. And your brain becomes extremely sensitive to small changes in blood chemistry, sugar, blood pressure, and minerals. And that's when danger creeps in. Because certain fruits, especially sweet, tropical, or acidic ones, can interact with the aging body like a trap. A banana at night. A glass of orange juice with your morning medication. A handful of grapes as a snack. These might seem like healthy habits, but in certain conditions, they become the perfect storm for blood clots and brain injury. Before we continue, if this information is already opening your eyes, take a second to like this video. Subscribe to the channel. It helps us continue sharing important advice like this with you and your loved ones. Because what you're about to learn could save lives. One of the most memorable cases I encountered was that of a 66-year-old man. Active, sharp, took great care with his diet. In the morning, oatmeal with banana. A glass of orange juice with his blood pressure medication. Evening walks. Everything seemed under control. Until one day, his wife found him collapsed in the bathroom. No speech. No movement on the left side. The diagnosis: a silent stroke during the night. The cause: an excess buildup of potassium, amplified by the effects of his medications, all intensified by the dietary routine he believed was healthy. And this happens frighteningly often. It's not negligence. It's the lack of clear information. What was once considered good can become an invisible trigger after 60. One fruit. The wrong timing. A silent interaction with your medication. And suddenly, the body's delicate balance is broken. In this video, I will reveal 7 common fruits. Fruits that seem harmless, but when consumed the wrong way, can drastically increase the risk of stroke, memory loss, brain bleeding, and sudden fainting. And more importantly, I'll show you how to keep enjoying good food without exposing yourself to the hidden danger that so many ignore. The secret lies in understanding what the brain needs after 60. It doesn't want surprises anymore. It needs stability, steady blood flow, balanced minerals, controlled sugar. But when you eat the wrong fruit in the wrong amount or at the wrong time, all of that is disrupted. And the worst part, you feel absolutely nothing. Until the day you feel everything, all at once. From now on, you'll discover why common habits, like eating a banana before bed, drinking orange juice with medication, or snacking on grapes between meals, might be triggering clots overnight. And why many of my patients only realized it when it was already too late. Let's start with a fruit that everyone considers innocent: the banana. Soft, easy to digest, rich in potassium. Apparently perfect. But for those over 60, this perfection can become a ticking time bomb. As you age, your kidneys naturally lose efficiency. They no longer filter out excess minerals the way they did decades ago. And if you take blood pressure medications, like diuretics or ACE inhibitors, the risk multiplies. Because these medications further alter the potassium balance in your blood. Now imagine this. You have dinner, take your medication, and before going to bed, you eat a banana thinking you're making a healthy choice. During the night, the body's circulation slows, the kidneys work less, and potassium begins to accumulate in the bloodstream. The result: the heart becomes unbalanced, the blood vessels constrict, and clots begin to form where blood should flow freely. As a neurologist, I've seen many cases like this. One patient told me he started eating 2 bananas a day to boost his energy. What he didn't know was that he was combining it with a medication that already raised his potassium levels. The result was a silent stroke during the night. When he arrived at the hospital, he could no longer move the left side of his body. And he's not alone. Because habits like this seem harmless. But in the aging body, what once was healthy can become deadly. And the worst part, no one warns you. The information simply doesn't arrive in time. Another common mistake. The classic glass of orange juice at breakfast. The problem goes far beyond the sugar, which alone is enough to trigger dangerous glucose spikes. Oranges, just like grapefruit and other citrus fruits, contain compounds called furanocoumarins. These substances directly interfere with the metabolism of many medications, especially those that regulate blood pressure, cholesterol, and heart rhythm. This means that by taking your medication with orange juice, you might be unintentionally multiplying or canceling out its effects. One of my patients had done this for years. Fresh juice every morning, along with his statin and blood pressure pills. One day, he felt dizzy upon standing, fell, hit his head, and arrived at the hospital confused. We discovered that his medication levels were completely unbalanced, and the juice was to blame. And then you begin to understand that the danger isn't just in the food itself. It's in the combinations, in the timing, in the silent interaction between the fruit and the drug, and most of all, in the lack of visible signs. Because symptoms don't show up right away. They accumulate, silently, until suddenly, everything collapses. And if by now you've realized something needs to change, keep paying attention. Because the next fruits, grapes, pineapple, watermelon, carry different but equally dangerous risks. Risks that affect your blood, brain vessels, and even the quality of your sleep. All of it slowly, almost invisibly, but lethal when it finally shows. Now let's talk about grapes. Small, sweet, juicy, and dangerously misleading. Most people believe that eating grapes is a healthy habit. But what no one tells you is that, after 60, these little fruits can cause a sugar spike as intense as a handful of candy. Modern grapes, especially the seedless and extra-sweet varieties, have been cultivated for taste, not for health. In an aging body, with more fragile blood vessels and greater glycemic sensitivity, the impact is direct. Skyrocketing glucose, deregulated insulin, silent inflammation in the cerebral arteries. And you might not even notice. It starts with a slight headache. Then, a strange fatigue. Next, dizziness when standing up. Small signs most people ignore, but for a neurologist, these are loud warnings that something is wrong with cerebral circulation. One of my patients, healthy and lucid, ate grapes every morning. She said it was her way of staying young. But one day, while reading, her vision became blurry. She tried to write a note, but the words wouldn't come out. She was rushed to the hospital. Tests revealed a mini-stroke. Her medical history was flawless, except for one detail: high glucose levels at noon and chronic inflammation in her brain vessels. The cause: daily consumption of sweet grapes without any protein or fiber to slow the impact. And that brings us to an increasingly common pattern. Seniors with seemingly healthy habits who, by combining sweet foods with medications or eating them at critical times, are creating an internal storm no one sees. And the next example is even more treacherous. Pineapple. The tropical fruit that many consider refreshing and light may actually be harming your brain while you sleep. The reason: an explosive combination of sugar, acid, and enzymes that affect blood clotting. Pineapple contains bromelain, an enzyme that, in large quantities or when combined with certain medications, can thin the blood too much and interfere with platelet function. And at night, when the body is at rest and blood vessels are already more constricted, this thinning can cause unexpected bleeding or, paradoxically, the formation of clots. One of my patients ate slices of pineapple every night for over a year, believing it aided digestion. But one morning she woke up disoriented. Tests revealed a stroke in the posterior circulation of the brain, an area sensitive to balance. The cause: unstable, acidified blood with irregular platelet function. All from a habit that seemed harmless. And there's more. The acid in pineapple can cause silent reflux during the night, irritating the airways and altering brain oxygenation during sleep. For the aging brain, this is a powerful trigger. The risk isn't immediate, but it builds slowly, like a trap disguised as freshness. And if you think a fruit full of water is always beneficial, wait until you understand the hidden effect of watermelon. It appears hydrating, but for those who take diuretics or have naturally low blood pressure, it might be draining more than helping. Watermelon acts as a natural diuretic. And when combined with medications that already remove fluids from the body, it can cause nocturnal dehydration. Blood thickens, circulation slows down. And where blood flows slowly, clots find room to form. A gentleman we treated, with an exemplary health history, began experiencing dizziness upon waking. He thought it was just old age. Until one day he fainted in the bathroom. The diagnosis? Ischemic stroke caused by silent dehydration during the night. The cause? 3 large slices of watermelon after dinner, combined with a diuretic medication. And it's precisely this kind of detail, the right fruit at the wrong time with the wrong medication, that turns a habit into a risk. The aging body has no margin for repeated mistakes. The brain doesn't give early warnings. It simply stops. And when that happens, recovery isn't always possible. At this point, you might be asking yourself, so what's left? What can I eat safely, without risking damage to my brain, my blood pressure, or my vessels? And that's exactly the question so many patients ask after a scare, after a diagnosis that could have been avoided. The answer is not to cut everything out, but to understand how, when, and with what to consume. For example, fruits should preferably be eaten during the day, when the body is active, circulation is faster, and the risk of accumulation is lower. Never on an empty stomach, never before bedtime, and never directly alongside medication, unless your doctor advises otherwise. Sweet fruits like bananas, mangoes, and grapes should be paired with sources of protein or healthy fats, such as nuts, plain yogurt, or a slice of cheese. This slows sugar absorption, reduces glycemic spikes, and prevents the silent inflammation that damages blood vessels from within. Acidic fruits like pineapple and orange should be consumed in moderation, always away from medication times, and with extra caution if you already use blood thinners, statins, or blood pressure medications. And what about watermelon, strawberries, or cherries? They should be eaten consciously. Never in large portions, never as a nighttime snack, and always considering your hydration levels, your blood pressure, and the medications you take. The real problem is not the fruit. It's the context. It's the aging body trying to maintain balance while receiving conflicting signals. A juice it can't properly process. A sugar that enters too fast. A mineral that should be filtered out but instead lingers silently, altering the bloodstream. That's why so many elderly people wake up feeling unwell, dizzy, confused, or simply don't wake up at all. And all of this happens without warning, without pain, without clear symptoms. The clot forms during the night, grows slowly, and suddenly. It severs the connection to speech, movement, or consciousness. It's devastating. And the cruelest part, it was preventable. You don't need to live in fear of the fruit bowl. You just need to look at it with the clarity of someone who understands their body. At 30, almost everything is allowed. At 70, every detail matters. The right fruit in the right amount at the right time can protect your brain. The wrong choice, repeated in silence, can be the trigger for losing your independence. And if you've made it this far, you're already ahead of thousands of people who still believe that everything natural is safe. It's not. Nature can heal, but it can also harm. The secret lies in the wisdom with which you use what you consume. And that wisdom begins with information. If this content opened your eyes, if any of these fruits are part of your daily routine, or if you know someone who needs to hear this, share this video. Like it, subscribe to the channel, and help others protect what is most precious: the brain, clarity, and independence. Remember, what you eat today can decide how you live tomorrow. And many times, the difference between a healthy life and a silent stroke lies in a simple snack choice. Choose wisely. Your future will thank you.